Hi, so I get asked often about cuff link tests and whether or not I should perform one before I extubate a patient. Now, this question isn't that simple. Um, there are patients that are much higher risk for post-extubation stridor than others, and there's some risk involved in doing the cuff link test itself. You know, when you drop the cuff of an ET tube, oral flora that's not native to the lower respiratory tract will certainly migrate there. And if there's any tension on the airway before you drop that cuff, that could mean that the airway migrates itself. So definitely some risk. What's the benefit? We know that a cuff link test has a fairly good rate of specificity, meaning that if I don't have a cuff link test when I drop the cuff, then I am likely to have a problem with that patient post-extubation, or at least the chance of that is fairly high. The sensitivity is not nearly as good as the specificity, meaning that even if I do have a cuff leak, doesn't mean that I'm not going to have problems with that patient. So, who do I do this cuff leak test on, given that there is some risk and some benefit? I look for the patient that's likely to have a problem. Those patients are typically patients that have been intubated for a long period of time. They've been extubated and re-intubated for post-extubation stridor. Maybe they're really volume overloaded. Maybe they've had C-spine surgery or they have a C-spine injury and have been instrumented. Or anybody really that, sort of seems like they potentially have upper airway edema. So those are the patients that I do perform the test on. That being said, if I'm going to perform the test, the literature is really leaning towards doing a quantitative test versus a qualitative test. And that means that instead of just listening for a leak when I drop the cuff, I should be putting a certain amount of volume in and paying attention to how much volume comes out to sort of determine and quantify that leak. So I'm going to drop a couple of papers onto our site. I'll put the PMID numbers there. All you need to do is follow those numbers and you can look at the papers yourself. But I don't recommend that you do a cuff leak test on everybody. I recommend that you do one that you're highly suspicious that they'll have upper airway edema. And if you do the cuff leak test, I recommend that you do a quantitative test versus a qualitative test.